Thank you, doctor. So let me now also, ask you questions to our other panelists out here. And my first question would be for Amanpreet. As Amanpreet had said that she had got breast cancer at the age of 43.
Yeah.
Right?
Yes.
So I wanted to ask from Amanpreet that, uh, how did your family take to it? How did you say this and inform it to your children? And what kind of, reaction did you get from them?
What I would like to point out here is it all depends on the patient. Like in our case, I was very positive about it. I accepted it the very first day. I did not panic. For me, I thought it is just another disease and I am going to beat it, fight it, right? So I was not scared. My daughter was studying in VIT hostel. She was in the hostel. So I did not tell her. I waited for a month or so. Then I invited her, like I asked her to come home. So when she came home, I made her sit down. And then I very normally told her, look, this is how it is. I have got this disease, and these are how we are going to fight it. It is curable. So you don't have to get scared. When she saw that I was okay with it, my husband is okay with it, we are brave, we are fighting it. So, like, in case we, inside us, we are panicking and trying to put a brave front, it doesn't work out. If you yourself are feeling strong enough, you're positive, confident, you can put it across to your children that way. And when they see it is curable, they accept it. So it is all about your mindset and how you break the news to the other person. So she took it positively. She was, yes, initially she panicked, she felt bad. But then I think when she saw my reaction to it, I was behaving normally, everything was normal. So she was fine with it. So you have
And
to be.
yes. And my other question would be is that once you were going through this phase in your life, did you have any support groups or did you take help from any support groups? And if you can tell our viewers about it.
I like the family was very supportive. My mother came over. She stays in Chandigarh. She came from there to take care of the house. My in-laws, they also came over. So my sister was there every chemo session. She would come from Chandigarh to be with me. So family support was very strong. I honestly did not have to worry one bit about anything. How to manage the house. I was very lucky that way because lots of patients have their jobs to do. They do not have that strong support system. Maybe they do not have the family that close by, or for any reason, they may not have that. So I was quite lucky that way. And my friends were very supportive. And then there was another in the hospital also. I spoke to other patients. So there was another person. I think most of us know her here, Dimple. She was there. She was almost through with her treatment. So she had been through so much, so she could guide me. She was always there to guide me, do's and don'ts about my diet, about the nutrition, about exercise, what all I should do, because she had been through the similar situation. So it helps. You need to build a support system, a positive support system around you. Stay away from negative people. They are going to pull you down. So I never interacted with anybody. I felt that they are going to look at it negatively. So what the learning has been to be surrounded by positive people who build you up. And if you are positive, everything is positive. It all boils down to being positive about it and feeling that, yes, you can overcome it. It is something you don't have to be scared of. It's just another disease. So I think it helps.
Yes, I agree. Agree totally that support groups are also very important because people who have gone through it, they can inspire you, motivate you, and apart from your family, I think there are foundations, organizations, trust which help people overcome this, especially women, because women are like that. They need to talk to each other, and when they talk to each other, I think you feel more lighter. Uh, I just want to say, in case we get disconnected, please rejoin on this particular link itself. So I will now move on to my next question with Sudha. Sudha, just tell us, like, I know that when you got diagnosed with breast cancer, you were pretty quick to know that, you have to go for an early examination, and you got detected early. So please tell us what line of treatment was offered to you, or did you take?
So the first thing was when I self-examined myself. I After that I went in for a mammography, which was always due. I have a family history of cancer, so anyways I was going through a yearly test. When I got that done, when they saw something suspicious in that, they did suggest an ultrasound. After doing an ultrasound, of course, biopsy was the next thing, and the line of treatment was absolutely dependent upon how you want to go ahead with it. After that, when I took the biopsy to the surgeon was Dr. Kanchan Kaur from Medanta. She told me, rejoice, there is nothing to worry about. You are 100% curable. We've detected it early, though it's a fast growing thing, but it's an early stage. So this was stage two basically. So she said there's nothing that we don't know about this disease, and we can cure it 100%. So that was very, even your doctor, as Dr. Mansi was saying, and as I have come across the other doctors, they're very positive. This is a good frame of mind that we come across, because if we don't have a person who's ready to talk to you, explain to you, then people feel that I'm in the middle of nowhere and everything has come up for me. So it was very nice of them to hold our hands, and I'm talking about all the patients, and take us further. Once the surgery was done, which is again a lumpectomy for my case, the breast conservation that we call, uh, I was told that chemo may be done, may not be done, depending upon further tests. So the only thing that I feel about all these things is, there is one thing that people should know very much in the beginning, is that when you do lumpectomy, you have to undergo radiation. This is what I was told. And when you do mastectomy, then you do not have to undergo radiation. Maybe, may not. Dr. Mansi can correct me probably if I've not understood the same thing. But many a times this becomes a cost-bearing thing for people, and they take the decision based on that, not based on anything else. So they must be told or highlighted about this issue definitely before they start their treatment.
So, Dr. Mansi, would you like to?
I have some short comments on this thing. So, very rightly said by Mrs. Sudha. Actually, when you do a conservation surgery, 100% you will require radiation therapy, because that is how we cover the rest of the breast, which is not removed, so that there is no recurrence of cancer in it. But also at the same time, if a mastectomy is being performed, that is a complete breast removal, you still might require radiation in 10-15% of these cases, because of the lymph node involvement. So sometimes the mastectomy, most of the time, as I'm saying, that 10-15% times only with mastectomy you would require a radiation. So 80% of the times, 80-85%, you can avoid this therapy. But this therapy is very safe, radiation therapy, and with the modern advancement and the newer machines, it's the side effects are quite less, and it's very targeted and precise radiation dose which is given to the breast. So it should not prevent you from getting a breast conservation surgery done, because it's very well tolerated. And down the line, the radiation therapy might happen for 3 weeks, 4 weeks, or 5 weeks. But down the line, like 2 years or 3 years after that surgery, a mastectomy and a breast conservation surgery has a huge psychological impact on patients. So this is a radiation therapy is something which should not prevent you from getting a conservation done. But yes, if you are getting a conservation surgery done, then radiation would be required. But the most important point which Mrs. Sudha said, and which I would like to highlight, is that a positive frame of mind of the patient and the positive attitude and the spirit is very much required. whatever treatment we give, whatever is the disease, but if the patient has this positive attitude, a fighter spirit in them, then it can be tackled very well. Because ultimately, whatever we are giving, injections or chemotherapy or surgeries, it's the body's immunity which is fighting. It's the body's immunity which is healing the scar. There's the body's immunity which is fighting against those cancer cells. So that immunity is linked with your spirit and the frame of mind and attitude. So that positive attitude is required, and if I have seen with those patients who have this kind of an attitude, they really do wonders, and sometimes miracles happen with those cases. And very good that Mrs. Sudha pointed out this.
Ma'am, one more thing I would like to ask, and I saw something amiss was the facts of nutrition. Most of the places we get a do's and don'ts. Don't eat this, eat this. What happens is for people who are aware, they will find the reasons. So just to tell you that whatever they told me not to eat, I did eat that. But I had a reason to it because all of the things which are told to us for not consuming, like you know, what we say, kacha, raw foods and all. The idea is basically not to get any infection. But if this is put up very clearly to the patients that आप ये चीजें खा सकते हो, but in a way where you avoid, you know, like heat it up or pass it through hot water, or you know, like fruits are to be peeled and have. If you cannot peel them, then you can run them through hot water and have it. So I did all of that. So whatever was told to me not to eat, I had a reason behind it that I will eat it because it's good for my body. So sometimes what happens is patients are told no do's and don'ts, they just decide without putting any thought to it. But I really felt that nutritionists and people should, you know, in this particular thing, should definitely guide, because I think what I ate made a lot of difference to my body during that time. So I think a little more emphasis on nutrition and on things like these should be taken up. Even a few supplements for that matter. That if your body needs a few supplements, it should not be left to you know, like a A to Z or a shell cal or whatever. A supplement may be required for the body. That should be briefed about that. Yes, you can do your research or you can take some help from a nutritionist. It really helps.
So, with that, I will now like to go on to Archana. Archana has been associated with an initiative called Cope with Cancer with Mother Trust. So, Archana, why don't you tell us more about it, and what kind of inspired you to be associated with the foundation?
Thank you, Pooja. So, Cope with Cancer is again a cause which supports cancer patients, and with the help of the Mother Trust. And they accept hair from donors, and they make wigs for people who might want. So I have recently donated my hair to them, and for me it was I mean, I'm a nobody, and you know, just a small gesture on my part, but they have been doing, Mother Foundation has been doing an amazing job in this sense. They provide wigs to cancer patients at Tata Memorial Hospital, and I was amazed the note that I received from Urvija, and what it said was that really moved me, that so far they have not refused even a single person, and they provide this facility to mostly underprivileged people who are not able to afford, so they do not charge anything. And of course the movement goes on because of, you know, donors who can you know. So I was reading about it, and my hair had grown long, and over COVID 2 years I didn't go to a salon, so they were just growing. And when I read this, I was actually inspired. I said, chalo, let me do this. So I went to my hairstylist, and I asked her, and yeah, so then we just went chop chop chop, and I mailed my hair to them. And so it was, the more I read and learn about what people are doing to support cancer survivors, it's so inspiring, it's so amazing. And then you feel good about it, just that. So now I know when my hair will grow again, that's what I'm going to do, it again and again and again.
Wow.
That's very nice. So I think this was something, when I read about it, that Archana has contributed her hair, it kind of, inspired me also. That this is, in a way, sometimes you feel, how can you help another person? And you don't know how to help. But there's so many ways you can help, like, through, even for cancer patients or any other person suffering from a different kind of cancer. So I think this was one of the very good thing which Archana
And
did.
Pooja, one more thing I would like to say is that I'm not a person who would, go putting up what I ate and what I did on social media. So this post was actually not about me, but about awareness, creating an awareness and sharing it with people in the hope that maybe somebody will read and somebody will feel motivated and inspired to do the same thing. So it was just that. It wasn't about me, but it was about cope with cancer and for the cancer patients.
Yes, that's exactly what I said. That you inspire a lot of people, because a lot of people want to help, but they don't know how to help. So when you have an avenue to help, then maybe you can help it from the periphery. Like as even Amanpreet said, that there was a Cheers to Life Foundation, which is run by Dimple Bawa, and in fact through her I got connected with Amanpreet. Because see, if you tell your experience, share your experience with the world, because it's not any longer a social taboo. It can happen to anyone because the cause is not known. So when the cause is not known, it's better to be aware of something like this, which can happen to most women. And as Dr. Mansi rightly said, 1 in 22 women in India get breast cancer. So at least you should be aware that if tomorrow I get it, my support system is ready. I'm ready to battle it out. And it's no longer, the cancer doesn't have the power, it is rather that you convert it into a simple zodiac sign. So that's what I believe in. So with that, I would like to now ask a question to Vandana. One of Vandana's family member had recently, if I'm not wrong, during COVID time, had cancer. So I just wanted to know from you, Vandana, how does an older age group take to this fact that they have got something like this? Because I feel the younger people who are of younger age group, they're more receptive and open about it. But maybe the older age group is still a little conservative. What do you think?
Yeah, so hi everyone. It was very good to hear Dr. Mansi, with all of the information. Though, because I've been actively assisting my mother-in-law with her treatment, so I'm aware of most of it. But it was really nice to, hear some myths busted. And about this hair thing, before I come to the question, Pooja, I would like to say something. It's so nice, Archana, that you've given your hair for this. I mean, it seems like a small thing to do, but believe me, I've seen my mother-in-law go through this whole process. And there was only once that I saw her sobbing. And I mean, like, she was literally sobbing so badly. And that was the day when, after chemo, her hair started falling in clumps. And she just started sobbing, like, oh God, my hair is going. And this was despite knowing that this would happen. I mean, she had time to prepare for it. She knew that this would happen. And she's 72, and she was so demoralized that after this it's never going to grow back. And we had to kind of really pump her up and inspire her. Nothing is going to happen, you'll be out of it very soon. And
she's got great hair, by the way. She's got great hair back.
Yeah, and I'm so happy because I think there's hardly a day when people don't compliment her that your short hair looks fantastic. It looks better than what it used to. And you know, she gets so many compliments, and I'm really glad about it. So definitely it's not a small thing, and especially not for women. And so coming to your question, Pooja, that uh, I'm sorry, I it slipped my mind. What did you ask exactly?
I was asking that, the one part you've already answered it. How does an older age group take on to know where,
Yeah,
when
yeah,
they
yeah.
have suffered the disease?
Yeah, so
And
in this case, I would say that very large part of it was her attitude. Even I got inspired by that because she was very, very positive about it, and she just from day one she took it that I have to fight this and get out of it. And I think also another part which was important was we told her that you have cancer and everything. The main parts we definitely informed her, but in her case the thing was that there was a lot of lymph node involvement. So it was actually a stage 3 kind of cancer, and we came to know after the surgery that there were a lot of lymph nodes which were involved, and there were high chances of recurrence. But we kind of did not exactly hide those things, but we did not uh, openly stress on it. And we did not um, tell her specifically that, this has high chances of recurrence, or, this is so. In that way, we kind of kept her protected because we wanted to have her maintain that positive attitude and not get, you
Sometimes
know,
ignorance is bliss. Yes.
yes,
The
yes.
immediate
So,
caregiver no, but yes, if that
yeah,
helped
I
her.
mean, she knew obviously that I have cancer, and she knows what goes along with it. But we did not discuss too much, and we did not, make her aware of exactly what was her prognosis and what are the chances of a recurrence. So, in a way, she was more positive because she felt that since, I'm getting so much support, I need to put in my best and, try and get out of it. So that really helped.
that's very nice because, I used to see Auntie, even once she had gone through it regularly on her walks when the pandemic situation improved. So tell me one more thing, Vandana, how difficult was it since she had it during the pandemic time in getting the
Yes,
treatment?
it was really terrible, Pooja, because she got diagnosed in the end of May 2020. And that was the time the pandemic was at the peak. There was a total lockdown. Even the hospitals did not have more than half the staff because things were not streamlined at all. And, even the Delhi Gurgaon borders were sealed. We could not get even second opinions from anywhere. And and in the midst of all this, there's also the fear of getting infected because you are going to the hospital every alternate day or at times every day. I mean, Pooja, it's not a joke that she was diagnosed in the end of May, and since from May to end of December 2020, that's about 6 months, we made at least 100 visits to the hospital, which translates to one visit every alternate day if you take an average. And, with the fear of COVID and all of that, it was very scary. And we just talked to a very close doctor friend, and he said, listen, I'm going there. And he's an ENT surgeon. So his job is to look into ears and noses and throats day and night. And, he said that, I'm doing this from morning to night. So what do you think I do? So he said, just stick to the basics. Just have your masks on, do a double masking, be very careful about infection protocols. And if you do that, you'll be safe. So we just followed that. So even though we were scared and all this, and touch wood, during that period, we all were safe.
Dr. Mansi, with this, I would want to, throw very important, I mean, from whatever I learned from Vandana, is that since now this pandemic has never happened in our lifetime, this is, I hope, the first and the last. But in case if it isn't, I just wanted to know, can the medical line do something like, give more online support where doctors are, because I know this is not possible, obviously, when you have to get certain treatments done and tests done. But apart from that, certain, like we have support groups, as Amanpreet was saying, even for doctor support helpline could be there, even for cancer, because this could be something anyone can face, and we still have yet not got out of the pandemic. But is there something which has been done about it, or which can be done about it?
Yeah, so this pandemic situation has definitely affected at many fronts, but in terms of cancer treatment, it had a huge impact because initially, like to begin with, only with the diagnosis, it was like we were having really late diagnosis happening because patients who had lumps, they were very scared of coming to the hospital, getting diagnosed and everything. So what already we have a huge burden of advanced disease, and then during this pandemic, what we were seeing were even more advanced cases. And I myself have examined and advised some certain patients to get the biopsies and everything done, but they just, because of the fear of COVID and the pandemic, they went home and they came like 6 months or 8 months later with advanced and sometimes metastatic disease. I remember precisely in the clinic, I was examining and convincing one patient, but she was so scared of the COVID situation that I really had to tell her that you might or might not get COVID, which is a possibility. Even if you get COVID infection, you might not be affected in a deadly way, or you might be, like, just get an infection and be over with. But if you don't get this treatment, then it's definitely going to kill you. So you have to give more weightage to a cancer treatment rather than being feared of COVID situation. But definitely because of the media and everything, and it was and especially with the second wave, which impacted us the most. It is obvious that patients and relatives are scared of getting the treatment done. So I have seen, like I myself within the team and in the hospital, we have been giving online and video consultation. So this is something which even we want to do, because obviously, as your ENT doctor friend, he said that every day he's looking into patients' mouth and he's exposing themselves. So for us, we know that we have chosen this specialty, so we are 100% giving in that maybe we might have a COVID infection, and that's it, because that's our choice of doing it. But with the patients, and especially with cancer patients who are receiving chemotherapy, their immunities are already low. We don't want them to get exposed to this environment. So online consultation was there, but certain times we do require a physical presence of the patients, and we have to do certain tests like CT scan, for example. The same CT scan, the COVID patients are also getting tested, and then the cancer patients are also getting tested. So it was a huge mess. But what we have learned from the past two waves, at least if we implement those things which were rightly highlighted by Mrs. Vandana, were that we just have to stick to the basics. So at least if God forbid the third wave comes, at least we have learned something from the past experience, that we have to stick to the basics. And COVID is not something which should prevent you from getting the cancer treatment done, because obviously it's a fear and stigma attached with all of the hype with the COVID. But cancer has been there for years now, and it is something which is time sensitive. So we can't just delay cancer treatments for months. When it is required to deal with the disease, we have to do it then and there. When surgery is over and you are required to go chemotherapy, so it has to be started within a week's time, like 3 weeks or 4 weeks. We can't just delay it for months. So cancer treatment is time sensitive, and nothing should prevent that from happening. But at the same time, because you are visiting the hospital, your relatives are visiting the hospitals, so you can actually follow the mask and the protocols of COVID. But also we have modified certain guidelines. So there were international guidelines and a lot of research done on this, on the cancer treatment aspect as well, that how we can minimize the visits of these patients to the hospital. So for example, if the chemotherapy is to be given weekly, we can plan a 3 weekly dose. So that was something which was done. Then similarly for radiation, there was something which is called a fast forward trial, a forward trial and a fast forward trial, which is still happening now, the fast forward, where we can reduce the radiation treatment from 5 weeks duration to 3 weeks, or sometimes 2 weeks duration. And similarly for surgical cases, certain diseases which are slow growing, hormone positive, we can actually start some hormonal medicines and delay the surgery for a while. Or for the benign diseases like the non-cancerous, we can actually postpone these kind of surgeries. So these were certain changes which happened in the medical perspective. But otherwise, what was the social impact of the disease? That was more towards patients being so scared, people being so scared that there was no screening happening. Anyways, we are already lacking on the breast screening programs. And because of this, there was absolutely, why would a person who has absolutely nothing, no problem, come to hospital during COVID pandemic to get themselves checked? So this was something which was not happening. So the impact, this what happened during this last year is what we are seeing right now with advanced diseases. Most of the time they have spread to other organs and it becomes very difficult to treat.
Thank you, Dr. Mansi. I think we have exceeded our time, but just to ask once more, has anyone have any question for Dr. Mansi?
I just want to say something. What Dr. Mansi said was absolutely, I agree with that. Screening was not happening. But what, I'll just tell you or share an experience during COVID time, because even my treatment was going on during COVID time, and the weekly chemos were switched to a 3-weekly one, and a lot of things were being done. But the patients that were coming in were so hell-bent that they didn't want to undergo treatment, that I had my medical oncologist doctor, she called me and she said, Sudha, since you are so positive about all of this, can you counsel 1 or 2 patients? Because what they hear from doctors is something different, and what they hear from patients is absolutely different. So, something like this, support groups are there. But even if you just attach with your own doctor who is, your regular oncological doctor, oncologist, oncological surgeon, if you just give your kind of support to them, saying that I'm available if you need some person, to counsel, to talk to a patient, even if you like. So I got a chance to do that to, I won't say counseling, but I would say talking to 2 or 3 patients of hers, which really helped, and she was very, all of them, we are right now friends. We're talking to each other on normal days too. But to talk to somebody who's undergone the journey, it makes a lot of difference. It just gives them, it's sometimes you feel I'm really asking stupid questions to doctor के पास time नहीं है, ये नहीं है, but आपके पास तो सारा time है. You can remove 15 minutes, 20 minutes, half an hour from your everyday life, maybe once in 10 days, and you could talk to them. It makes a lot of difference to boost up their morale and to get them out of, you can help them sail through.
I think with that, shall we end the session?
Yes.
If all are okay. So I just want to add the thank you note to Dr. Mansi, Amanpreet, Archana, Vandana, Sudha for giving your time and making this session so informative. And as being an artist myself, I would just say, you beat cancer in how you live, why you live, and in the manner in which you live. So it's high time that we do not be a victim of cancer, but survivor of cancer. It's the mindset that needs to change. Thank you all.
Yeah, so thank you, Pooja, for inviting us and organizing such a wonderful session. And it was absolute pleasure having all the panelists. So to see them so compassionate, so empathetic about the situation. And thanks a lot. Have a wonderful evening.
Thank you. Thank you.
Good night, everyone. Bye-bye.
Bye. Bye.
Thank you so much, Pooja.
Well,
it was very nice.
Nice. So I would be even, just to let you all know, we would be also sharing the recording on our group so that more people can, hear about this. And I hope that we don't have any such patients, or rather, people going through this. But in case they do, they become cancer survivors, and I hope this session gives them a lot of courage and inspiration. Thank you all.